This is Sean Sullivan from Alston Bird's digital health team with an important update on remote patient monitoring, or RPM services, which CMS just clarified that for purposes of the minimum time requirement includes both interactive communication and non-interactive care management services. Medicare has reimbursed RPM since 2018, and since January 1st, 2019, has used the RPM CPT code of 99457 to reimburse for remote physiologic monitoring treatment management services requiring interactive communication with the patient or caregiver for at least 20 minutes per month. Now, until this year, CMS had not clarified what exactly that 20 minutes included, but oddly stated in the 2021 Physician Fee Schedule final rule that the code required at least 20 minutes of time spent interactively communicating with the patient or caregiver, in addition to whatever time the practitioner spent reviewing and analyzing the patient's RPM data and updating the patient's plan of care. CMS stated this both in the proposed rule and in the final rule, but CMS's interpretation has frustrated and confused RPM providers and frankly does not seem consistent with the purpose and use of RPM technology. But thankfully, on January 19th, 2021, CMS published a correction to the Physician Fee Schedule, stating that the required 20 minutes of time for 99457 includes both interactive communication with the patient or caregiver and time engaged in non-face-to-face care management services. This welcome correction for RPM providers means that the practitioner and or their clinical staff only need to devote 20 minutes per month total to RPM services in order to bill for 99457 or the add-on code 99458. Thanks, and keep in touch with our digital health team for the latest on RPM billing requirements and other developments on the digital transformation of healthcare.